things people talk about a desire to be successful, all of the elements. Good morning, everybody. Dr. Rick Wallace dropping in on you. I hope that everybody has had a good week. You're preparing to do whatever it is you're going to do over the weekend. I will be spending time with family, actually still getting some work done, and ironing out some issues within the business. And I am focusing on a more precise movement within the work I do in the black community, and I want to talk to you about that briefly here. As always, I'm um, soliciting your support emotionally, spiritually, financially, as well as with your time if you're able to lend us um, what you do in a professional sense to help make an impact in the community. All of that's good. Um, what you're about to see is a video uh, made by Dr. Nadine Burke Harris via TED Talk Med. This was done 6 years ago. It's done, but it's immensely prevalent now. It's a part of work I've been doing for at least the last 15 years in understanding the current state of Black America specifically, but blacks in general. And so I want to talk to you about it and give you a little insight before you watch it. I want you to see her explanation of it because I like it. It simplifies it. It takes a lot of scientific data and medical terms and psychological terms and a bunch of other things, and it puts it in a easy to understand 15-minute message that is immensely powerful. But we're talking about the impact of adverse childhood experiences on the overall life outcome in health and productivity and socialization of people. I want to focus specifically on my people because that is always going to be my focus. You start inward and you work out what you deal with what's going on at home, and you work out what you deal with what's going on in your own enclave. And then you invest yourself into making the world outside of that enclave better. We tend to expend ourselves outside moving in, and we neglect ourselves and leave ourselves in a position of vulnerability to the vicissitudes of life and so much more. So I want to talk to you a little bit about what you're about to hear, and tell you what I plan on doing. Some time ago, as I was researching to write The Miseducation of Black Youth, and then ultimately my 19th book, Born in Captivity. There have been three other books since then, but Born in Captivity deals with psychological elements and the physiological interconnectivity, and how it's all come together to create what we know as multi-generational trauma, and what that means in the scope of who we are, how we operate, how we function. And so, with the study of multi-generational trauma, I became aware of an element of science known as epigenetics, the influence of gene expression, the influence on gene expression, the upregulation and downregulation of genes, the passing on of epigenetic tags of trauma from the progenitor to the progeny, and how that is impacted, but also how life experiences of an individual over the course of time have a genetic impact, and how those environmental experiences can end up upregulating disease genes. How the exposure to negative environments and negative realities and experiences can make a person more likely to experience health issues, psychologically and physiologically. And so we're talking about everything from depression to ischemic heart disease, coronary heart disease, asthma, diabetes, and so much more. Well, what we also now, based on a study known as the Adverse Childhood Experiences Study, we now know that there are a number of different what's known as ACEs. Each adverse childhood experience has its own category and it's on a 7 point scale. The 7 points are abuse, and abuse is physiological abuse, emotional abuse, and psychological or sexual abuse. Neglect is physiological and emotional. Parental mental illness, one of the parents is suffering from some form of mental illness. Number 4 is substance abuse, someone in the home is suffering from an addiction. Number 5 is incarceration, one of the parents has become incarcerated. Number 6 is parental separation or divorce, where parents split. And number 7 is domestic violence. Each one of those carry a point. What I can tell you is, during this study, we find out that it is a far adverse childhood experiences are far more common than anyone in this country would like to admit, regardless of socioeconomic status. The initial study was done in a more affluent, more educated. It was 70% white, 70% college educated, initially done, and still in that we found that 70%, 67% to be exact, 67% of the people who were a part of the study, over 17,500 people that were a part of the study, had at least one ACE. They had experienced one of those 7. We found out that 12.6% of those had experienced at least 4. Now, here's the problem. When you get to 4 ACEs, you start talking about increased risk for depression, increased risk for ischemic heart disease, increased risk for diabetes and asthma, increased risk for suicidality. And matter of fact, the increased risk for suicidality in comparison to a person with 0 ACEs and a person with 4 ACEs is 12 times. A person with 4 ACEs is 12 times more likely to attempt to take their own life than a person with 0 ACEs. And there are a number of different factors. One of the postulations that come as a natural observation of life would say, okay, people from certain backgrounds tend to make certain decisions. But here's the thing: even people who came from more affluent backgrounds still experience it. Even people who didn't smoke, who didn't drink, still had a higher risk of ending up with lung cancer. And so you have to sit up and say, okay, it's not something as simple as behavior. There are other elements. That's where we start to talk about the epigenetic influences. Now, Dr. Nadine Burke Harris, does not really mention the word epigenetics, but it's definitely implied when you understand the science of epigenetics and how epigenetics influences you. You have to understand that everything about this is built on what's known as the stress response, the part of the brain that senses a threat and triggers the adrenal gland, which reduces stress hormones, cortisol and adrenaline, which heightens your alertness, increases your heart rate, opens up your arteries to receive more oxygen, diverts oxygen from the prefrontal cortex, which takes 30% of blood flow and oxygen at any given time, and sends that out to the extremities, the arms and the legs. Why? Fight or flight. Everybody's heard of that, right? Well, fight or flight is when you sit up and you get that fear that something's going wrong, and your body prepares you to do one or two things: either run away from it or defend yourself against it. And that worked great thousands and thousands and thousands of years ago, when it was absolutely necessary for hunters going out and facing off against a saber-toothed tiger. It works now if you get caught. Dr. Harris uses the analogy of being in the forest and running into a bear and triggering the stress response. Absolutely necessary, because you need to be at your highest alertness and have the most strength available to either run or to defend yourself. The thing is, and she makes this point, what happens when the bear comes home with you every night? What happens when the bear is there waiting on you when you get home as a child and it's triggered every night? And what you can learn is searching the stress hormone cortisol is great for short periods of time to deal with momentary, temporary stress. However, when you get to a point where you are consistently experiencing it, we call it chronic stress, and it's absolutely devastating to the organs of the body. It is something that has a natural degenerative genetic imprint. And so you are literally reshaping DNA, not the sequence, but the expression. Gene expression is controlled through environment and experiences on a regular basis. When you have someone, and what's the big point on this? The big point on this is children, especially before the age of 10 and intensively before the age of 7, are still developing mentally all the way up to age 22 to 23. Are developing, but definitely under 10 are developing mentally, emotionally, and their brain is still developing. So when they experience these things, there's a natural impact at a higher intensity and higher level that they cannot process. And so you end up with what we are seeing with the outcomes, health outcomes. We're not just talking about poor decision making. We're talking about a shortened life expectancy. Someone with four ACEs has a shortened lifespan of about 20 years. You lose 20 years on average from experiencing four ACEs. And so I've been looking and doing this research, like I said, for years, and just sitting up. And I was telling my wife, these last few weeks have been really, really hard on me emotionally because I'm just looking at so many things going wrong and feeling so helpless in my ability to impact it. And so what I've decided to do is actually become even more focused in a specific area. It's hard to work with people as adults to give them help when they don't even realize they need help, when what is killing them has become a normal part of their reality. When dysfunction is now appearing as functionality, it's real difficult to walk in and say, let me show you a better way, when they think that's how it's supposed to be. So what can we do? We can protect the children. We can start interventive processes that will allow us to guard children against these adverse childhood experiences, and also know that when they do score high as far as adverse childhood experiences are concerned, that there are processes of treatments that Dr. Harris will mention here, and I will be talking about in the coming days and weeks and moving forward, that can be done to minimize the impact before it becomes an issue and a problem. And that's where we've got to be active. We have to protect our youth. Now, I've been talking about this for years, and I'm trying to give a sense of clarity to it. So I've been talking about it for years. Look, check out this video. Let me know what you think about the video. Let's start getting together and actually putting together programs that allow us to protect our children. We have to go to the source. We have to have a plan of action. Complaining and whining about what's happening is not going to change what's happening. Actually curing whatever is ailing us at the source is how we heal. And we heal physically, emotionally, psychologically, and spiritually. And that is what I want to see us do. On that note, I'm going to get out of here. Hope you enjoy the video. Thank you.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California. And together, we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle, and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, "Dr. Burke, have you seen this?" In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior, and that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you'll want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and, frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across a lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real, and this is all of us. I believe that we are the movement. Thank you.
Hello, everybody. Dr. Rick Wallace here, dropping in with a little special announcement. For those who have followed me for any stretch of time, you know, outside of the businesses that I run, like Myriad Business Solutions, the Visionetics Institute, Odyssey Media Group, I also do a great deal of work inside of the inner city communities in Houston, Dallas, and other areas. I'm asking now, as we push a fundraiser, that you support what the Odyssey Project is doing in the inner cities, especially with programs like Black Men Lead, which is a rite of passage initiative, and Restoring Ghetto's Forgotten Daughters, which is a program focused on helping young girls, but boys as well, suffering from childhood sexual abuse, rape, molestation, domestic abuse, absentee fatherhood, and so many other things. The information will be in the box. Thank you.
From a conceptual perspective, things people talk about a design that they success all of the elements